Scores of pinwheels pinned up in Sao Paulo to remember the 600,000 Brazilians who have died of COVID-19. It's a symbolic farewell to victims, an opportunity for families to say goodbye to loved ones, with many funerals not possible in the pandemic. Each wheel is someone mourning, each with a family, friends left behind who miss them. It's not just 600,000 people who are gone, it's a lot of people who die with them, emotionally. Brazil has the highest coronavirus death toll after the United States, even surpassing the US when taken as a percentage of the population. Infection and death rates are slowly easing, but that's little consolation for the bereaved. Welcome to our COVID-19 special. It's just a little flu. Go to work. No need for masks. Now, the words of Brazil's President Jair Bolsonaro. Meanwhile, 600,000 people died on his watch. People angry with the government's management have taken to the streets to call for change.
Frustration taken to the streets of Brazilian cities, directed mainly at the country's corona-skeptic president, Jair Bolsonaro. No country has been able to escape COVID-19, but many people here are angry that Brazil has lost so many more lives than most nations. With 600,000, it's the second highest death rate worldwide, and per capita, Brazil is among the top 10 countries suffering the greatest losses.
This is a pandemic denialist government spreading a policy of death, whose economic agenda has driven people to starvation. We are in a desperate situation here, and the president doesn't seem to care.
Even as Brazil dominated global headlines with spikes in infections and images of mass graves shared around the world, Bolsonaro didn't change his tune, calling the deadly virus just a little flu, and minimizing the strain and losses people were suffering from. He has also repeatedly spoken out against mask wearing and vaccines, while promoting unproven medicines for use by doctors, including recently in a speech at the United Nations.
We respect the patient and doctor relationship with the decision on the medication to be used and the potential for off-label use.
Within the government, there is also frustration. For months, Brazil's Senate has been investigating Bolsonaro's pandemic management, including the use of taxpayer money to purchase experimental medicines. Just last week, whistleblowers detailed information about a hospital chain pushing the use of such off-label meds on the elderly. So the doctors explained to me, they gave the COVID kit of meds to the patients and told them, I have to give this to you, because if I don't, they can fire me. But I can tell you that if you take anything from here, take only the proteins and the vitamins, because the other medicines, besides having no efficacy, could be dangerous, specifically for the elderly. Bolsonaro's approval rating has dropped to just 22%. But not everyone has criticism for the president. On September 7th, large crowds came out to show support for Bolsonaro on National Day. But as the pandemic continues to take lives, several local governments are moving forward with their push to vaccinate, even extending shots now to young people. And more than 200 municipalities are also introducing a vaccine passport, which Bolsonaro strongly opposes.
For more, I'm joined by Ana de Limos, Executive Director for Doctors Without Borders in Brazil. Good to have you with us, Ana. Now, back in April, when we talked about Brazil, we talked of a humanitarian catastrophe unfolding there. What is the situation now?
Good morning, Monica. The situation has improved a lot, mainly because vaccination. We have already 45% of the total population vaccinated with 2 doses and 71 with 1 dose of 210 million people. And that has had a big effect in recovering from this from this so tough crisis. I was emotioned with your summary just now in the beginning. It's really, it's a lot of suffering, a lot of pain that we all passed during these 18 months.
Indeed.
But now the situation is indeed much better, despite
Right.
the sad day that is today. Yeah,
Right.
sorry.
Well, yeah, absolutely right. And let's just take a quick look at some numbers to know what exactly we're talking about. With a population of 211 million, Brasilia reports a total of 21,500,000 COVID-19 cases. That's 10% of the entire population. Currently, there are 15,000 new cases reported every day. Not to forget, of course, the high death toll of 600,000 so far. So, Anna, could those deaths have been prevented?
This sad day that will make 600,000 deaths, yes, many of them could have been prevented. Of course, the pandemic affected all the world, but in a country with a very functional public health system, with a lot of capacity, including to vaccines production, because of public health institutes that were amazing during all this crisis, we didn't have to pass through all this situation. So yes, many of them could have been prevented.
And how big a role did politics play in all this? The public health service in Brazil, was it prepared for it?
The public health service was the one who had to deal with those situations in the end of the chain. Brazil was prepared for it, but didn't react well. Politics is always essential in a public health issue, and mainly in a pandemic. So misinformation, fake news, uncoordinated responses, all that led to this number of loss of lives that we still cope to believe it.
Right. Well, you said at the beginning that things are getting better. So looking ahead, what needs to be done now to get the pandemic under control in Brazil and end all the suffering?
So we'll need to continue with the preventive measures and continue to use masks or hands, and to continue to increase vaccination rates and be ready, continue the production to be ready if more doses will be needed. But if go on this pace of vaccination, there's not a lot of denial that people adhere to vaccines in the country. So that will help a lot. But it's vaccines and prevention, as it always was.
And people are ready to take the vaccine. There is not much skeptics there. Did I understand you correctly? So it's just about actually having access to it.
Yes, Brazil has a big tradition on vaccination, and most of the people adhere to it. There's not a lot of skeptics indeed, despite some messages from the federal government.
Okay. Ana de Limos, Executive Director for Doctors Without Borders in Rio de Janeiro. Thank you so much for your time.
Thank you, Monica. A pleasure.
As we heard, Brazil's president described COVID as a little flu. How true is that claim? One of our viewers put that question to our science correspondent, Derek Williams.
What's the survival rate of people who get the flu? How does that compare to the survival rate with COVID-19?
One of the things that people who refuse to be vaccinated often say is that COVID-19 is actually only as deadly as the flu, right? That's incorrect. And let's look at some of the numbers that show why. According to a strategy paper for fighting seasonal flu that was published by the World Health Organization in 2019, so pre-COVID, it was claiming between 290,000 and 650,000 lives annually worldwide. Now, let's compare that to the number of people who've died so far this year from COVID-19, which the WHO's dashboard clocks in at between 50 and 100,000 deaths nearly every single week. In other words, within the first 10 weeks of 2021, the coronavirus killed way more people than the worst recent flu epidemics did in a whole year. Calculating survival rates is very difficult because flu statistics are notoriously mushy. Lots of cases are never reported, and it's hard to attribute cases directly to flu rather than, say, the pneumonia that it can lead to. And And the same is true for COVID-19. Testing for COVID also remains expensive or downright impossible in many places. So the best we can do is estimate what's called the case fatality rate. It's calculated by dividing the number of confirmed deaths from a disease by the number of people diagnosed with that disease by a test. It shows, for instance, that before the pandemic, the CDC in the US counted between 1 and 2 confirmed deaths per 1,000 diagnosed seasonal flu cases there. For COVID, it's currently counting about 16 deaths per 1,000 diagnoses. That backs up what most expert opinions I've read say, which is that as far as we can estimate something this vague, COVID-19 is up to 10 times more deadly than seasonal flu, and maybe more.
Now, before we go, here's a look at some of the other COVID-19 stories making news around the world. Washington, D.C.'s cathedral bells tolled out for 700,000 COVID deaths in the United States. Fresh data from Johns Hopkins University shows that more people died in the United States so far in 2021 than in all of 2020. And finally, some good news. Germany has vaccinated more people than previously recorded by official tallies. The country's Institute for Infectious Diseases, the Robert Koch Institute, says around 5% more people have got the jab than previous. The data came to light after a survey and gives hope of early relaxation of at least some measures. That's your COVID-19 special update. Thanks for watching.